This is Family Medicine Case Study Number 2, Group B. Each member's contribution to the group project is listed below. A 55-year-old male patient who has not been in to see the doctor for several years has an appointment for his annual exam. We must evaluate his current health condition as well as risk for health decline. Through this evaluation, we can educate the patient of such risk factors as well as provide information regarding life changes that can be made to reduce such risk. We will utilize the acronym RISE to complete the patient's health assessment. This includes risk factors, immunizations, screening tests, and education. According to the CDC, the recommended adult immunizations can vary based off of lifestyle, pre-existing conditions, and at times occupation. The influenza vaccine is recommended annually. A one-time dose of Tdap is recommended for ages 11 to 64, as well as a TD booster shot every 10 years. For adults over the age of 50, the recombinant zoster vaccine is recommended. This is a 2-vaccine series given 2 to 6 months apart. For adults over the age of 60 who have already received the live zoster vaccine, it is recommended that they be revaccinated with the recombinant vaccine. In immunocompromised patients, their close contacts, and pregnant women, live vaccines are not recommended. Given Mr. Reynolds' age and health, it is recommended that he receive Tdap, influenza, zoster, and pneumonia vaccines. Given his health history, we are in agreement with the CDC recommendations for the 4 previously mentioned immunizations. Some of the key factors that led to this decision are his cardiovascular status, his elevated BMI of 31.56, and the fact that he is a current smoker. We would also recommend that Mr. Reynolds download the SHOTS app on his cellular device, which will allow him to read more on each of those vaccinations. Next is health education. Through health education, we hope to influence healthy behaviors, better health decisions, and a better understanding of health information. In order to promote health literacy, we must create a therapeutic private environment, use clear tones when speaking to the patients, use language that they are familiar with and can understand, encourage questions, and we must also be aware of each individual's learning style based on their age, beliefs, current knowledge, and any barriers to learning that they may have. Nurses have the responsibility to respect the decisions of patients and their families regardless of whether we agree with said decision. We must also respect their autonomy and practice non-maleficence, justice, and beneficence. Heart disease is the leading cause of death in Americans. Our patient is considered to be at risk for cardiovascular disease given his elevated blood pressure, his BMI, the fact that he smokes, and his physical inactivity. This places him at risk for metabolic syndrome, including abdominal obesity, dyslipidemia, hypertension, and insulin resistance. Cardiovascular disease can be prevented. We will encourage him to quit smoking, eat a healthy diet, maintain a healthy weight, exercise regularly, as well as following up with his doctor about his blood pressure, cholesterol, and checking his blood sugar. Cardiovascular disease can be diagnosed if indicated through X-ray, EKGs, stress tests, and coronary angiograms. Nutrition. The nutrition assessment is a vital part of the preventative routine exam because a patient's dietary choices can affect his risk for coronary heart disease, diabetes, certain cancers, as well as stroke. 93.3 million adults in the U.S. suffer from obesity, according to the CDC. MyPlate may be helpful for patients to get a visual understanding of food proportions. On the CDC website, you're able to calculate the BMI in order to then set weight reduction goals. First, we must help our patients set a nutrition goal as well as a weight goal. We would encourage him to decrease his caloric intake as well as replacing his soft drinks or sodas with water, and eating 5 smaller meals instead of 3 large meals throughout the day. More information on nutrition guidelines can be found on the American Heart Association. Furthermore, we will assess our patients' openness to meeting with a dietitian for additional nutrition counseling. Because our patient is at risk for heart disease, the American Heart Association would recommend a heart-healthy diet, which includes a daily sodium intake below 2,400 milligrams. Recommended foods to eat would include fish such as salmon, tuna, and trout, vegetables and fruits, lean meats, and whole grains. Recommended foods to avoid would be sodas, candies, foods high in sugar, dairy, and animal fats from meat. Next is exercise. Exercise is defined as planned, structured, and repetitive body movements performed to improve or maintain one or more components of physical exercise. In this case study, Mr. Reynolds is a 55-year-old man who is 5'10" and weighs 220 pounds. This gives him a BMI of 31.6, which is classified as obese. In order to help him reduce his weight, as well as his risk for cardiovascular disease and cancers, Mr. Reynolds would benefit from an exercise regimen. Regular exercise is shown to have a positive impact on one's life. Not only will it help reduce our patient's weight and his risk for diabetes and high blood pressure over time, but it will increase his bone density, his endurance, and his muscle retention. Currently, only 23% of the adult population performs enough regular exercise for it to have a significant benefit to their health. The Physical Activity Guidelines for Americans recommends completing at least 2 types of physical activity for a total of 150 minutes per week. This includes aerobic exercise and muscle strengthening. Some aerobic exercises include walking, running, swimming, and bicycling. Examples of muscle strengthening and muscle retention exercises would include incline walking, cycling, Zumba, weightlifting, as well as resistance band training. By adopting a healthy diet and weekly exercise routine, Mr. Reynolds is not only decreasing his weight and working towards reaching a normal BMI, but he is ultimately decreasing his morbidity. Stress. Because stress is a part of everyday life, it's important to identify each person's ways of coping with stress. Having a social support is vital to managing stress. This could be family, friends, or even coworkers. Effective communication is needed, not only to express ideas, but also to express one's feelings. Many people find meaning, purpose, and connections through their spirituality, while others use humor strategies, such as telling jokes or reading jokes, to cope with stress. Practicing self-awareness throughout the day can help you manage stress, as well as identifying what your stress factors are. Relaxation techniques may also work. This could be anything from breathing exercises to listening to music, cooking, golfing, hiking, even just being out in nature, whatever it is that works for you. Adopting healthy stress management skills may also help your patients who are trying to stop smoking. Poor sleep may also be affecting your stress levels throughout the day, which is why sleep diaries may be helpful in creating better sleep patterns, as well as maybe having a sleep study done. It is recommended to avoid drinking large amounts of fluid prior to bedtime, and to avoid use of electronics or watching TV right before bed. Complementary and alternative therapies. Holistic care versus allopathic care. Holistic care deals with healing the whole person, which takes into account the physical, mental, and spiritual well-being of the patient, whereas allopathic care deals with the clinician only treating the physical ailment at the time. There are various types of complementary and alternative medicine, or CAM, practices. First, there's natural practices, such as herbal therapy, probiotics, nutrition counseling, hydrotherapy, and aromatherapy. Second, there are body-based and mind-body practices. These include meditation or guided imagery, massage, spinal or bone manipulation, and thirdly, there are energy work practices. This would include acupuncture, acupressure, and touch therapies. In Mr. Reynolds' case, natural and mind-body CAM practices would be useful in his healthcare journey. He could benefit from meditation and imagery on his journey to quit smoking and visualizing himself no longer smoking. This would also be useful in him imagining himself at his healthy goal as well as completing more exercise. Natural practices that could benefit Mr. Reynolds include nutrition counseling. He could also use the meditation and imagery before he makes his nutrition modifications and visualizing himself eating healthier foods, having that water instead of soda. The case study on Mr. Reynolds is a wonderful example of how a good health history and physical exam can guide a plan of care for patients. By using the acronym RISE, we make sure to identify our patient's risk factors, offer immunizations and screening tests that are indicated, and educate our patients. Primary prevention is truly the key to longevity and positive patient outcomes. It is our duty to keep our patients safe, and we must utilize every resource and take advantage of every opportunity to educate our patients and help them live their healthiest lives. Thank you for listening and watching our presentation. Again, this is Group 2. All references are listed on the following 2 slides.